Okay, today I'm having the dermal infusion treatment, which is a good treatment to remove a lot of the summer damaged skin. And I've got some pigmentation on my skin, a little bit that you can't see so easily here. I've also got some fine lines and wrinkles that have occurred over the summer. So this treatment should help to exfoliate a lot of those dead cells, and we'll show you it right now. Thanks.
Okay, today we're doing a microdermal abrasion treatment on Dr. Ursel. And first off here, we're going to degrease his skin with acetone, which is very smelly. You okay there? Can you breathe now?
Yeah, I can breathe, yeah.
Okay, now we're going to do an enzyme mask. And the enzymes will break up the protein called keratin, which is in the top layer of the skin, the stratum corneum, all those dead skin cells. And so this will let the dermal infusion treatment penetrate more evenly and more deeper over his whole face, and let the product penetrate down into the epidermis and the dermis. You may get a slight little stinging with this. Feel anything yet?
No.
This isn't for all skin types. This wouldn't be for somebody with sensitive skin, but because Dr. Ursel has a thicker skin, this will work really well for him. Okay, so we're just finishing up with the enzyme peel. We're just going to let it sit and do its job. He's feeling it a little bit right now. Is it tingly, burny?
It's starting to sting a bit, yeah.
Okay. A scale of 1 to 10, 10 being bad, what are you at?
5.
So I'm just washing off the remains of the enzyme mask, and then I'm going to start with the dermal infusion. So Dr. Ursel has a little bit of pigmentation up here on his forehead and a few little spots here on the upper cheek as well. So we're going to do a solution today called Lumixil, which is to lighten up the pigmentation. So this is the machine here. The Lumixil infusion has been put onto the machine now, and I've added on a tip. I'm using an 80 grit tip, which is basically a diamond encrusted tip, which is like sandpaper, and I can choose the coarseness or the fineness of the sandpapering I want to do. With Dr. Ursel, because he has thicker skin and some acne scarring and some pigment, I'm choosing a more coarse tip for his skin, because his skin can handle it. Okay, so we're going to start by doing a long pass on his forehead here. As you can see, the product is coming out the tip, so as we exfoliate that stratum corneum, the product can then penetrate deep into the epidermis and dermis of the skin. And because we're using a product with the dermabrasion machine, this is making it very comfortable for him. It's a wet application versus a dry, so it feels nice and cool.
Yeah, isn't it?
So as you can see, Dr. Ursel's skin has some slight erythema to it, some slight pinkness, which is exactly what he should look like after a treatment. So we'll be doing 3 passes in Dr. Ursel's face today. This is the first one. So So this is going to remove that top layer of skin, which is going to bring forth some nice youthful skin cells. So it's going to look really good afterwards, nice and hydrated, moisturized, and less pigment. So we're on the second half of the face now. And how's this feeling, Dr. Ursel?
Pretty good. Not painful.
So we're just finishing up our second pass of 3, and as you can see, he's just mildly pink. So we're just finishing up Dr. Ursel's treatment here. And I'm going to be applying a hydrating mask, a cooling mask on top of this, just to calm his skin down and to take away any irritation he's feeling. How's that feel?
Good.
Cooling it down?
Cooling it down, yeah.
This is the Lumixil cream going on. And now that the skin has, the dead skin has been sloughed off on the surface, this can penetrate deeper into the pigment. And now I'm applying vitamin C and sunscreen. And vitamin C will lighten pigment as well. It's an antioxidant, so it helps to fight all the free radical damage. It's an exfoliant, so it will exfoliate the skin even more. But it also has anti-inflammatory properties to help reduce redness. And then the sunscreen, of course, to protect the new skin that's on the surface now. How do you feel?
Good.
No burning?
Oh.
Alright, Dr. Ursel, how are you feeling?
Pretty good. The treatment's done and feels pretty good right now.